I could never be the person I am today without the relationship I've had with PAS. I'm a proud graduate of the Dentist Wellbeing Program that was administered by Peer Assistance Services. I entered the program in 2000 and I exited in 2003. I can't fix my broken brain with my broken brain. I need resources, I need help. And Peer Assistance gave me help with dignity.
Peer Assistance is a Colorado not-for-profit corporation and was started to initiate prevention and early intervention programming for nurses, RNs, and LPNs.
I think I was president of CNA when they came to me. I said, "Don't tell me we're starting another group." That was my initial reaction. "We don't need to start another group." But then they persuaded me. And so I got involved. I even went around the state, giving information to nurses all over the state, asking them to be supportive of the effort.
We actually incorporated the agency with the Secretary of State on April 18th, 1984. The large group of nurses were interested in working with the Colorado Nurses Association to do something about nurses who were sanctioned publicly for having an illness. And the illness was alcoholism, as we called it then, substance use disorder, and often co-occurring mental health issues.
I focused on the fact that we were losing nurses to practice because the board was being very strict in their disciplinary action if nurses were found to be using any kind of substance that they believed impaired their practice. Their license was gone or they couldn't practice for a while. So we were losing caregivers. There was such a need to support nurses who were struggling.
The American Nurses Association passed a resolution in its delegate assembly to reach out, intervene with, and support the rehabilitation of those nurses. And from that came a monograph called Addictions and Psychological Dysfunctions, the profession's response to the problem. And that particular document was a policy statement about what nursing should be doing for its practitioners who encounter these problems.
Colorado was one of the first states to begin to organize a program specific to nurses.
Nurses would come to Peer Assistance, oftentimes referred by the Department of Regulatory Agency that oversees nurses' licenses. And then the staff would really surround that person with support and help to guide them through regular check-ins with staff to see how they were doing, all the way through to helping them to access treatment if that needed to be the case, or our self-help support groups. Over time, the program expanded to include other licensed professionals.
Pharmacists also came on board, the veterinarians, the dentists, the mental health professionals, to name a few. There are a high number of folks who were able to get to a place where they were healthier and able to continue their practice.
What makes Peer Assistance Services so unique is that we are trying to help people who are in the business of helping others, whether that's mental health clinicians or nurses, veterinarians, other professionals.
We changed the name, which was Nurses of Colorado Corporation, to Peer Assistance Services Incorporated, to be more welcoming to other professions. We have maintained our prevention message with ongoing outreach to the healthcare and mental health communities. And the employers of many of these professions, and that when there are signs of potentially impaired practice, then that is the time to act.
The most important thing that we focus on and give attention to is prevention. The fact that Peer Assistance focuses on prevention, early detection and early intervention, working with providers so they can still be engaged and provide these services themselves. That's really where the majority of the impact of potential is.
Peer Assistance Services is one of the only organizations that I have ever come across in my journey that only focuses or primarily focuses on prevention and early intervention and the opportunity to make greater impact on the front end before individuals are really experiencing challenges with substance use.
SBIRT was a grant to the state, screening, brief intervention, referral to treatment. And it is an evidence-based practice, in particular, the research around alcohol use.
SBIRT is a well-proven methodology for identifying substance use and getting people referred to treatment early and having better outcomes because of it.
We were the only state to have received 2 consecutive rounds of funding from the Substance Abuse and Mental Health Services Administration, SAMHSA. So we had the benefit of learning from 5 years of implementation and really getting our feet under us in terms of what it meant to build a sustainable implementation practice of screening, brief intervention, referral to treatment within primary care and other healthcare settings. And then taking that knowledge and expanding that beyond those 5 years into another round of 5 years.
Colorado was awarded 2 back-to-back grants totaling 10 years. And we were able to work with a legislator to identify funding in order to continue the services.
This could have faded away. Once the money was gone from the federal government, this could have easily faded away. But a lot of credit goes to Peer Assistance Services for being willing to find the resources, to continue to staff the program, to continue to work with the providers to provide this training.
We have been able to maintain that effort with state-of-the-art training that is virtual and that anybody could access at any time. So for a state like Colorado, that's particularly important with all the rural areas that we have.
They've done just outstanding work with SBIRT and looking at how we can expand this practice across the state. And in most recent years, the movement towards really refining or improving and helping to increase the screening for adolescents has been really critical. So this has been a new phase of concentration effort for them.
Programs that we have, Peer Health, which is based on an employee assistance model of service delivery. It's very specific and very rigorous with the health professionals that we provide care to. And then screening, brief intervention must follow the evidence and the specific type of training that we offer, which generally has continuing education associated with it. So those 2 programs, because one has a major education emphasis, and the other is more specific to individuals. And so they continue to complement each other. The need clearly remains.
The comprehensive, holistic nature of this program really sets it apart from others across the nation.
This agency is more than the founders, and I was one of them, could ever have envisioned. The enactment of the peer health programs in practice acts, in law, is a sea change for the health professions to deal with an illness that threatens a practice but can be life-threatening. Also, along with that, the stability of a funding mechanism, which is license fees, a very small portion of license fees, is really critically important for the stability and the consistency and the continuation of programming.
I know several pharmacists who have gone through it, and it's for them transforming to say, hey, I thought I was done. I thought my career was over, my whole life was over because of this, and I have a chance now to keep my career and get myself well. This organization is a shining example in Colorado and nationally of what this potential is and what it can do, often leading in these areas.
They're not judgmental. They're there to provide support and to help people with getting connected to services and really working their way to recovery and back to their professional practice and being safe in terms of protecting the public.
When you hear stories from people about how their lives have been changed or sustained in a positive way, you can't help but love it and want to continue it and see it continue to grow.
I hope that there's a peer assistance services in every state across the country. So I think we need more organizations like Peer that are focused on exactly the mission that Peer is focused on, and certainly the benefit that Peer has had in the state of Colorado, I think we could see really on a national basis and even an international basis.
My hope for the next 40 years is that it continues to grow, it continues to develop, continues to be a real beacon in the industry in terms of assisting professionals getting the help that they need for addiction, for mental health issues, and so that they can get back on track in a real robust way and continue to help folks.
This 40 years, 4 decades, has brought time for some reflection and recognition of immeasurable gratitude for countless colleagues with their support and counsel. But most significant is making a difference in the lives of health and mental health professionals who are challenged every day with the complexities of a stigmatized illness. And I'm grateful to have been a part of that.
Keep at it, grow bigger, grow stronger, and hopefully we can touch more lives.